One of the coolest things that's happened over the course of my career is seeing the evolution of thought in the concussion space, with the recognition that is now mainstream that injuries to the cervical spine could be responsible for the symptoms that present in patients presenting with post-concussion syndrome. So I want to take you through a quick journey on how I got here. So it started about 12 years ago. I started taking care of a patient that was an equestrian. They fell off their horse, they hit their head, they weren't able to compete during the equestrian season, and they developed symptoms of dizziness, headaches, and dysautonomia after their concussion. And they had seen many concussion clinics, and they were going and getting vestibular therapy, but for whatever reason, it just didn't work for them. So this is before I got into the neurological rehabilitation space. So at this time, I was only practicing upper cervical chiropractic, and within about 4 weeks of doing these very low force NUCA style adjustments, the patient was able to resume her riding career and was actually competitive within about 4 weeks of getting care. And you can actually read about that case in this study, and it's published in the Journal of Upper Cervical Chiropractic Research. I started getting more into the concussion space, and I started to look for literature to support my hypothesis, and I ran into this author. His name is Dr. John Lettiny. He published this paper, Brain or Strain, Symptoms Alone Do Not Distinguish Physiologic Concussion from Cervical and Vestibular Injury. Lettiny was one of the first to say that concussions are a multifactorial injury. Most people associate concussions with just a physical injury to the brain, and that the disruption in the metabolic processes in the brain are what causes people's symptoms. But Dr. Lettiny was one of the first people that was really outspoken that said we have to sometimes look outside the brain to explain someone's symptoms, and we should look especially at the cervical spine and at the vestibulo-ocular system. And in this super interesting paper, what he actually found was that just by the symptoms alone, you could not really tell the difference between someone that just had the physiological aspects of a concussion versus those that had more of a cervical or a vestibulo-ocular type of an injury, and that their symptoms would be pretty similar across groups. I was actually so excited about reading that paper that I actually invited Dr. Lettiny to be on my podcast at the time called Heal Yourself Radio, and we actually did an interview where he talked about some of his findings, and now he actually has worked with some upper cervical chiropractors in the past, working on some of the complex concussion cases he sees at the University of Buffalo. You could listen to this episode of the podcast. It's still found on my YouTube page at Keystone Chiropractic and Neuroplasticity. And we've come a long way, so we recognize that the cervical spine can be a really important piece of the puzzle when managing the concussion patient. But what I really want to get across now in 2024 is that cervical spine injuries can be a really important risk factor in delayed recovery from a concussion. Brains can metabolically recover in as little as 30 days, but some of the injuries to the joints, ligaments, muscles, and sometimes neurological tissue that happens in the neck can sometimes take months to get better.